Does poor posture cause chest pain? Good posture is particularly important for spinal health and well-being. The way the body is held during rest or activities or movements can introduce a lot of forces to the spine, its surrounding tissues, and really the entire body in general. And we know that slouching or constantly looking down at devices, slumping your shoulders forward, leaning one way all the time can lead to long-term spinal health problems because it introduces stresses and adverse tension throughout the entire body. And poor posture, unfortunately, over time can lead to chronic issues. And this chronic poor posture syndrome, I like to call it, can cause pain, can cause malfunction, can lead to degeneration, can even lead to changes in shape of your body that become more than just postural, but actually become structural. For example, if a person is constantly looking down at devices, not keeping the shoulders back, the spine straight, and devices at eye level, over time, they may develop, significant kind of a forward head posture. Their shoulders can round. They can develop shoulder pain, upper back pain, and neck pain because this position becomes more embedded in their body, and it leads to from a posture problem to now a structural problem. So therefore, any type of posture problem that becomes a structural problem can become more significant. Now, poor posture can definitely affect the chest and chest function and chest pain. In fact, one simple thing that you can do is you can just take yourself and you can just round yourself unnaturally. You can feel how it's harder to breathe. It's harder to function properly. You can imagine a person that's like that the whole time. So this can cause chest pain, soreness, stiffness. So a person that has this slouchy posture, shoulders rounded forward, can experience chest pain because the chest is being curled inward, find it harder to breathe, and rather being opened up and stretched by keeping the shoulders back. Now, this rounding of the shoulders may initially just be, you're not carrying yourself properly. But after years and years and years of this can actually now start becoming a structural problem. And once it becomes structural, it becomes much more difficult to manage. Now, a person initially can just improve their posture by just being aware, by remodeling themselves, being aware of what's going on and kind of holding themselves back. And this is when it's still what we call a postural issue, performing exercises, holding the body in a healthy position. Sometimes a patient can just do physical therapy exercises or postural exercises, and this can help sometimes. Also, while it's in this postural form, sometimes just stretches, help release tension, opening up the strained muscles. But once these problems become more structural, typically now they're going to need more types of care, and now they may need some customized mirror image exercises to help teach the patients. They may have to even do some therapy in a clinic, some traction or some opposite types of exercises. They may even need chiropractic care. Once these problems have become more structural and just postural, things like it must be treated more like a structural condition, very often like scoliosis. Now, scoliosis can be associated with poor posture, but scoliosis is a structural condition from the very forefront. So once posture problems become structural, they have to be addressed very often like a scoliosis case. Now, scoliosis causes the spine to bend and twist unnaturally. It tends to be initially diagnosed in children, but unfortunately, it can be diagnosed in any ages. And one of the main effect in scoliosis that we see is some type of postural asymmetry. Now, since this is a structural problem, you can't just move your body and straighten scoliosis. It is truly structural, just like I mentioned, these postural problems can become. And once scoliosis becomes structural, it induces uneven forces throughout the entire body, which can affect its symmetry. Now, scoliosis that develops in the thoracic spine or the mid-back can be associated with chest pain, can be associated, and because it starts affecting the rib cage, and it starts affecting the rib cage just like carrying your body like this, very rounded. As you start getting scoliosis, it can start affecting and torquing the rib cage, and this can lead to chest pain. It can lead to, in severe cases, the ability for the body to breathe properly, or lung impairments can become a complication in very severe cases. And the best way to minimize the potential effects associated with a structural scoliosis is to treat it proactively. No difference than it is to treating a posture problem and not letting it become more structural is to treat it proactively. So we know posture is important because over time, poor posture can introduce uneven forces to the body, which can become more structural. Therefore, chest pain can develop in a patient that sits in this slumped forward posture as they become more tight and more structural over time, becoming more curled inward. Healthy posture involves holding the shoulders back, chest open, body open, head over shoulders, shoulders over hips, and keeping the body in this straight alignment. If you can't pull your body back into that position, then that tells you that your posture problem has now become structural. You may have to seek more further treatment from a professional that can help you get your body or your posture back into that normal position. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.